Good morning. I'm Anna Schmidt, and today I'll be talking a little bit about security and privacy in health systems. Today, we'll cover what exactly e-health is, its benefits and challenges, some key frameworks, and future directions. So, what exactly is e-health? Well, e-health integrates technology into healthcare for better care delivery and outcomes. The World Health Organization defines it as basically the secure use of information technologies in health-related fields. Examples include EHRs, telemedicine, and IoT devices. E-health encompasses a diverse range of technologies aimed at improving patient care, data accessibility, and healthcare delivery. First, electronic health records, or EHRs, are digital patient charts that provide real-time access to medical history, allergies, medications, and test results. By centralizing patient information, EHRs enable faster, more accurate decision-making and enhanced coordination among healthcare teams. For example, a physician can review lab results entered by another department instantly, reducing errors and redundancies. Beyond individual care, anonymized EHR data supports public health research and outbreak monitoring, making it a vital tool for healthcare improvement. Next, we have personal health records, or PHRs, which are managed by the patients themselves and empower individuals to track and share their health data, such as blood pressure and medication schedules. These tools are especially useful for managing chronic conditions, providing patients with greater control over their care. By sharing PHRs with healthcare providers during appointments, patients can ensure that teams have comprehensive information for personalized care plans. Next, we have the Internet of Things. IoT devices, including fitness trackers, insulin pumps, and remote monitors, collect real-time health data such as heart rate and glucose levels. This data is transmitted to providers or cloud systems for analysis, enabling proactive management of chronic diseases and reducing the need for frequent hospital visits. IoT enhances efficiency and allows for the timely interventions in patient care. And finally, telemedicine. Telemedicine leverages video calls, apps, and phone consultations to eliminate geographical barriers, making healthcare more accessible. During the COVID-19 pandemic, for example, telemedicine ensured care continuity while reducing transmission risks. Beyond consultations, it supports remote diagnostics and follow-ups, solidifying its role as a versatile and essential e-health solution. E-health technologies collectively improve patient care, enhance data accessibility, and revolutionize healthcare delivery, paving the way for more connected and efficient healthcare ecosystem. So, why does exactly this all matter? Well, it first improves accessibility, which enables care in underserved areas via telemedicine, for example. It also enhances patient outcomes with real-time monitoring for timely interventions. It's also very cost efficient in reducing administrative overhead and resource waste. And it empowers patients to take control of their own health, such like tools like PHRs encourage that patient engagement. And finally, it facilitates global collaboration, enhancing international research and best practices in general. Now, e-health is a dynamic field driven by innovative technologies and evolving healthcare demands. This slide highlights the 5 major trends shaping modern healthcare systems. First, we have AI in healthcare. Artificial intelligence is revolutionizing precision, efficiency, and decision-making. Predictive analytics can identify high-risk patients, enabling early interventions, while diagnostic tools enhance the early detection of conditions like cancer. Beyond clinical use, AI optimizes hospital operations, managing resources and workflows. Next, we have wearable devices and IoMT. The Internet of Medical Things, or IoMT, connects wearable devices like fitness trackers, enabling real-time health data sharing. These tools empower patients to manage their health and support hospitals in reducing stays through remote monitoring and improve chronic disease management. And we also have blockchain technology. Blockchain secures data with its decentralized, immutable structure, safeguarding patient records and enabling secure exchanges between providers. It also strengthens pharmaceutical supply chains by ensuring medication authenticity and reducing fraud. Next, we have telehealth expansion. Telehealth has grown rapidly, especially post-pandemic, offering virtual consultations, remote diagnostics, and follow-ups. It improves access for underserved populations, reduces wait time, and eases hospital crowding, making it an essential component of modern healthcare. And finally, the digitization of records. Enhanced standards in cloud storage have streamlined data sharing between providers, reducing redundancies and ensuring coordinated care. Digitized records also support analytics and research, providing insights into population health trends. The accompanying graph on this slide shows the steady growth of these technologies, with a notable spike in growth of these technologies during the pandemic, highlighting its role in care continuity and e-health's increasing importance. But e-health also comes with its challenges. Some key challenges are data security, which with rising cyber attacks require more robust safeguards. Regulatory compliance and navigating laws such as HIPAA is very resource intensive. There's also the issue of interoperability, where legacy systems hinder data exchange due to not having support of hardware or software necessary. It also has high cost of implementation, especially with smaller providers. And there's also a lot of resistance. Staff just need more training to adopt digital tools. But e-health technologies also bring transformative advantages, enhancing healthcare efficiency and improving experiences for both patients and providers. Here's a closer look at the benefits, starting with improved accessibility. E-health expands healthcare access through telemedicine and mobile health apps, allowing patients in remote or underserved areas to consult specialists without extensive travel, promoting more equitable healthcare. It also streamlines workflows. Automated systems like electronic health records and digital scheduling reduce paperwork, minimize errors, and ensure better coordination among healthcare teams, allowing professionals to focus more on the patient themselves. It also enhances patient outcomes. Real-time monitoring with IoT wearables enables early interventions and personalized care, reducing hospitalizations and improving quality of life for patients with chronic conditions. It also saves a lot of money in the long run. E-health lowers costs by reducing in-person visits and hospital stays. Automation decreases administrative expenses while optimizing resource allocation and enhancing operational efficiency, enabling reinvestment in better care. There's also data-driven decision-making, where analytics tools provide insights that refine treatment plans and identify at-risk populations, improving outcomes for individuals and communities through informed, proactive healthcare strategies. And finally, it also empowers the patient themselves. Personal health records and mobile apps give the patient greater control over their care, fostering engagement and improving adherence to their treatment plans, often leading to better overall outcomes. By improving accessibility, streamlining workflows, and driving better outcomes, e-health proves essential for modern healthcare, benefiting both patients and providers. But e-health technologies, while e-health technologies enhance healthcare delivery, while also offering significant cost-saving opportunities for both organizations and patients. Mainly, administrative savings. Automating tasks like scheduling, billing, and record keeping reduces administrative overhead and streamlines operations. For example, electronic billing systems replace time-consuming paper processes, lowering costs and minimizing errors. It also reduces the need for redundant testing. Centralized electronic health records eliminate unnecessary diagnostic tests by ensuring providers have access to complete patient histories. This is especially beneficial for patients with chronic conditions, which saves money, time, and reducing overall patient stress. It also provides an efficient resource allocation. Data analytics and e-health systems help optimize resource use by forecasting trends like seasonal increases in emergency room visits. This enables healthcare facilities to allocate staff and equipment effectively, maintaining care quality while controlling costs. And there's also savings through telemedicine. Telemedicine reduces expenses by minimizing the need for in-person visits. Patients save on travel, and providers cut operational costs. Chronic disease management costs can drop by up to 20% with telemedicine use. And there's also the cost benefits of the Internet of Medical Things, or IoT, which supports preventive care and reduces hospitalizations by enabling real-time health monitoring. Devices like glucose monitors and heart rate sensors catch issues early, improving patient outcomes and lowering costs overall. eHealth's cost-saving capabilities are reshaping healthcare systems, making them more efficient and patient-centered. But it doesn't come without its own risks. Cybersecurity threats, like data breaches and ransomware, are becoming increasingly more prevalent. There's also the risk of system failures, which network outages will disrupt care delivery. There's also the vulnerabilities in the Internet of Things, where connected devices need much stronger safeguards to protect them against attacks. And people are concerned about their own privacy, where eHealth has to ensure compliance with privacy laws such as HIPAA. And ultimately, interoperability issues are a main thing as well, with fragmented systems delaying effective care. This graph on this slide highlights the escalating impact of data breaches in healthcare, with over 100 million individuals affected in 2023 alone. This stresses the critical need for implementing robust security measures and policies to address these growing risks effectively. Now, the Internet of Things has transformed healthcare by enabling connected medical devices that improve patient care and outcomes. However, these devices also introduce critical vulnerabilities that must be addressed to ensure patient safety. IoT devices in healthcare provide real-time monitoring and data transmission, aiding in disease management and early detection. For example, insulin pumps can adjust dosages automatically based on glucose levels, enhancing patient convenience and care. Now, there was a FDA warning on Medtronic devices in 2022. The FDA's warning about vulnerabilities and specifically two Medtronic devices highlights the risks in IoT healthcare technology, with the key vulnerabilities being one, the lack of encryption, with insufficient encryption in wireless communications expose these devices to potential interception and manipulation of data, posing serious risks to patient safety, and also unauthorized access. Vulnerabilities allowed unauthorized users to alter devices, settings, or disable functionality altogether, potentially endangering patients' lives, such as modifying pacemaker configurations. These issues stress the need for robust security measures in IoT devices to prevent cyber attacks, protect patient data, and ensure safety. The FDA's warning has driven manufacturers to improve security protocols, prioritizing the patient's well-being. While digitization has advanced healthcare, it also has made the industry a significant target for cyber attacks. Here are some of the key threats impacting e-health systems. With phishing attacks, phishing uses deceptive messaging to trick employees into revealing sensitive information such as login credentials. For example, an attacker impersonating IT might send a fake email prompting staff to click on a malicious link, compromising the systems. There's also data breaches with weak security protocols and insider threats, leading to data breaches, exposing patient records and financial details. These breaches can result in identity theft, financial fraud, and reputational damage to the facility, making prevention a critical challenge. And ransomware. Ransomware encrypts essential healthcare data, halting access until a ransom is paid. This can paralyze operations, delaying care, and endangering patients. For example, a hospital's inability to access electronic health records during emergencies can have absolutely devastating consequences. There's also the threat of DDoS attacks, or distributed denial of service, which can overwhelm servers with excessive traffic, disrupting access to online services like patient portals and telemedicine platforms, significantly affecting both the providers and the patients themselves. And eHealth isn't completely safe from insider threats. Insider threats arise when employees inadvertently download malware or misuse their access privileges, compromising sensitive data. Addressing these risks requires stringent access controls and robust employee training programs. And IoT itself can have its own exploits. IoT devices such as connected monitors and smart medical tools often lack robust security measures. Attackers can exploit these vulnerabilities to intercept data or disrupt device functionality, jeopardizing patient safety and care delivery. Assessing these risks is vital to ensuring the security and reliability of modern healthcare systems. Now, frameworks like NRAM play a pivotal role in guiding the adoption of digital healthcare technologies, addressing key challenges and driving transformation in e-health systems. So, what exactly is MRAM? Well, the Electronic Medical Record Adoption Model, or MRAM, is an eight-stage framework created by the Healthcare Information and Management Systems Society to support the implementation and optimization of electronic health records. It tracks an organization's journey from basic digital record keeping to advanced analytics and decision support in a fully integrated digital environment. So, why does this matter? Well, MRAM is a roadmap for progress, providing a structured pathway to enhance digital capabilities. It promotes consistency and interoperability across healthcare systems globally, and it prioritizes safety, efficiency, improved clinical outcomes through technology integration with a more patient-centric focus. As seen in this table, as of 2017, most US healthcare organizations were in the mid stages, like 5 or 6, of MRAM adopting advanced clinical documentation and decision support systems. Only a small percentage had actually even reached stage 7, highlighting the ongoing effort to achieve fully integrated paperless digital maturity. This shows MRAM's importance as a roadmap for organizations striving to modernize and improve patient care through digital transformation. MRAM provides a roadmap for individual healthcare organizations and also offers global insights into the progress of EHR adoption across nations and regions. This graph tracks MRAM scores from 2011 to 2017, highlighting digital integration progress. Denmark, the United States, and the Netherlands lead in e-health adoption, showcasing their strong commitment to advanced digital healthcare. Denmark, a global leader with a 2017 score of about 5.4, supported by robust healthcare infrastructure and government policies. The US, on the other hand, scored a 4.8 and is driven by the High Tech Act, which incentivized EHR adoption itself. These examples highlight the impact of strategic national efforts. Meanwhile, with some mid-level performers, nations like Spain, Turkey, and the UK show steady progress with scores between 2.3 to 3.6. Challenges mainly include interoperability issues, financial barriers, and workforce training. Their journey reflects the complexities of achieving digital maturity. And regions with lower scores, like APAC in the Middle East, reflect early stage adoption due to limited funding, infrastructure gaps, and regulatory challenges. Despite these obstacles, these regions exhibit upward trends, signaling increased investment in e-health technologies. The variation in MRAM score highlights the importance of tailored e-health strategies. High-performing nations refine advanced systems, while developing regions focus on establishing the foundational frameworks to enhance healthcare equity and accessibility. Having explored MRAM globally, let's now examine its first 4 stages, which lay the foundation for transitioning from paper-based systems to basic digital capabilities. These stages are essential for enabling more advanced integration in the future. Starting with stage 0, which is completely paper-based systems. Organizations typically start at stage 0, rely entirely on paper-based processes. Patient data is managed manually, leading to time-consuming workflows and increased risk of errors. But this is just the starting point for digital transformation. With stage 1, which encompasses basic digital infrastructure, at this stage, basic infrastructure such as servers, networks, and storage systems is established to support EHR adoption. However, data remains isolated and is not yet integrated into clinical workflows, which still limit its impact. At stage 2, which encompass enhanced clinical data capabilities, digital systems begin to include lab reports, imaging results, and diagnostic information. Clinicians can electronically access basic patient data, improving efficiency and accuracy. However, cross-departmental integration is still very limited. But at stage 3, you get basic EMR adoption. Stage 3 sees the adoption of electronic medical records to document clinical encounters and manage patient data. This reduces paperwork and improves accessibility, but EMRs often operate as standalone systems without integration into external platforms or advanced analytics. Now, as we move on, stages 4 and 5 of MRAN build on foundational digital systems, focusing on advancing clinical workflows and enhancing patient safety through sophisticated tools and processes. Stage 4 has the more advanced EMR systems. Advanced EMR systems include clinical decision support tools that provide real-time alerts, reminders, and evidence-based guidelines to assist clinicians. For example, an EMR can warn a doctor about potential drug interactions during prescription, reducing the risk of adverse effects. This stage also emphasizes cross-departmental data sharing, improving care coordination, and reducing redundancies. And stage 5, which is closed-loop medication administration. Stage 5 enhances patient safety with closed-loop medication administration, integrating barcode scanning with EMRs to ensure accurate medication delivery. For instance, nurses verify medications and dosages by scanning the patient's wristband and the drug, reducing errors such as incorrect dosages or wrong prescriptions. These stages represent a shift from basic digital systems to technology that actively enhances safety and efficiency. By adopting decision support tools and closed-loop processes, organizations reduce errors, improve patient outcomes, and increase operational efficiency, progressing significantly towards digital maturity. And finally, stages 6 and 7 of MRAM represent the peak of digital transformation in healthcare, focusing on advanced analytics and creating fully paperless environments to optimize clinical decision-making and operational efficiency. Stage 6 is the advanced clinical decision support and analytics step. Stage 6 integrates advanced decision support systems into EMRs, enabling predictive analytics and evidence-based guidelines to improve patient care. For instance, the systems can identify patients at risk for sepsis or adverse drug reactions, prompting early interventions. Real-time analytics support performance tracking, resource optimization, and identifying growth areas. Tools like AI-driven insights and data dashboards enhance precision and efficiency in care delivery. And finally, stage 7 is a fully paperless and analytics-driven environment. Stage 7 achieves a system where all clinical and administration processes are digitized. Comprehensive data integration ensures seamless care coordination across departments. Advanced analytics not only enhances individual care, but also supports population health management. For example, during a disease outbreak, real-time analytics guide resource allocation and interventions, improving response effectiveness. These stages demonstrate the transformative power of e-health, where technology proactively supports clinical decisions in healthcare management. Stage 7 marks the maximum operational efficiency, improved patient safety, and data-driven insights that benefit providers and patients alike. These two stages embody the ultimate vision of MRAM, showcasing how advanced analytics and fully integrated digital systems can revolutionize healthcare into a more efficient and patient-focused model. But implementing MRAM and achieving advanced digital maturity involves overcoming significant challenges that can hinder progress. One of these is financial constraints. Transitioning to advanced digital platforms demands substantial investment in software, hardware, infrastructure upgrades, and ongoing maintenance. For smaller organizations or those in underserved areas, these costs often delay or even prevent adoption. There's also technical challenges. With legacy systems, often incompatible with modern EHR platforms, create interoperability issues. Integrating these systems with other technologies such as IoT devices or external labs requires substantial technical resources and expertise. And there's also workforce resistance and training. Staff resistance to new systems is very common, often due to unfamiliarity or workload concerns. Achieving advanced MRAM stages necessitates extensive training for clinicians, IT teams, and administrators to ensure effective use of new technologies. There's also data privacy and security challenges. Digital records increase the risk of cyber attacks and data breaches. Organizations must implement strong security measures and comply with regulations like HIPAA or GDPR, adding complexity to the transition process. And there's also time and workflow disruption. System integration and training sessions can disrupt workflows, causing downtime that impacts patient care and operational efficiency. Balancing implementation demands with daily operations is a very critical challenge. Addressing these challenges requires thorough planning, sufficient funding, and robust training programs. Successfully overcoming these barriers is essential to fully realize the potential of e-health technologies. Now, having explored the challenges and implementations of MRAM and advancing digital healthcare, it's time to examine what the next frontier is: medical cyber physical systems, or MCPS. These systems represent a groundbreaking integration of medical devices with advanced computational technologies designed to work collaboratively in real time to enhance patient care and decision making. Now, MCPS is defined as safety-critical, context-aware systems of interconnected medical devices that monitor, analyze, and respond to patient conditions in real time. Combining sensors, software, and communication technologies, these systems create an intelligent and integrated healthcare ecosystem. And some of the main characteristics of MCPS include: one, real-time data collection and decision-making, and two, remote monitoring and control, and three, connectivity to hospital networks and cloud systems. Point one, MCPS process real-time data from devices like heart monitors and infusion pumps, enabling immediate analytics and interventions in high-stakes scenarios such as ICU monitoring. Point two, these systems allow healthcare providers to monitor patient conditions and adjust treatments remotely. For example, a physician can track glucose levels and modify insulin delivery via connected devices. And point three, MCPS integrate with hospital networks and cloud platforms, ensuring seamless data sharing. This connectivity allows clinicians and administrators to access up-to-date information supporting coordinated care. The diagram illustrates how MCPS operates. Data collected from monitoring devices is transmitted to support systems like EHRs. Decision support systems analyze the data, providing actionable insights that trigger alarms or inform caregivers for timely interventions. MCPS exemplifies the transformative potential of technology in healthcare, offering real-time, context-aware, and coordinated care. These systems represent the next significant step in creating safer, more efficient, and patient-centered healthcare environments. While MCPS offer remarkable advancements, it also brings unique security challenges. Let's delve into the specific vulnerabilities of the devices that form the backbone of these systems. MCPS relies on a variety of interconnected devices, each introducing potential security risks. These vulnerabilities can compromise patient safety, privacy, and the functionality of healthcare systems. Implantable medical devices, or IMDs, are critical devices like pacemakers, insulin pumps, and neurostimulators are particularly vulnerable to cyber attacks. For instance, a lack of encryption in wireless communication can enable attackers to intercept or manipulate signals, endangering lives. Stronger security protocols are essential to protect these life-sustaining devices. There's also wearable devices. Wearable devices, including fitness trackers, heart monitors, and smartwatches, collect and transmit real-time health data to providers. However, limited security features often make them susceptible to unauthorized access and data breaches. A compromised wearable could expose sensitive health information, undermining the patient's trust. And there's also risks in diagnostic and monitoring devices. Devices like X-ray machines, CT scanners, and infusion pumps are integral to MCPS, but are often overlooked during security evaluations. A breach of these devices can disrupt workflows or compromise diagnostic accuracy, potentially harming patients. And overall, connected devices and IoT in healthcare pose a lot of security risks. The Internet of Medical Things connects devices across the hospital ecosystem, enhancing efficiency and care coordination. However, this connectivity also creates multiple entry points for attackers. For example, a single vulnerable device could provide access to an entire network, jeopardizing data integrity and system functionality. Addressing device-specific vulnerabilities is key to securing medical cyber physical systems. By strengthening the security of individual components, healthcare organizations can create safer and more reliable environments for patient care. Having explored device-specific vulnerabilities in MCPS, let's turn our attention to the network and communication risks that threaten interconnected systems. MCPS depend on reliable communication networks for data transmission and connectivity. However, these networks introduce critical security challenges that, if left unaddressed, can compromise the entire system. Unsecured communication channels. Many MCPS use unsecured communication channels to transmit sensitive data. Without encryption, these channels are vulnerable to eavesdropping and data theft, exposing patient information and compromising privacy. Then there's also man-in-the-middle attacks. MITM attacks occur when hackers intercept communication between devices, manipulating or stealing data. For instance, an attacker could alter medication dosage instructions sent between a doctor's terminal and an infusion pump, putting the patient's safety at risk. There's also distributed denial of service attacks, where with DDoS attacks, overwhelming the network infrastructure with excessive traffic, disrupting the functionality of connected devices. In a healthcare setting, such an attack could delay critical treatments, block access to patient records, and impair hospital operations. There's also outdated network security protocols. Legacy network systems often lack modern security protocols, making them vulnerable to breaches and malware. These outdated systems are weak links in the security framework of MCPS. And also inadequate access controls. Weak access controls allow unauthorized users to infiltrate MCPS networks. Without proper authentication mechanisms, attackers can access sensitive data. For example, the absence of role-based access controls might let a low-level user manipulate critical administrative or clinical information. Addressing network and communication vulnerabilities is essential to safeguarding MCPS. Implementing robust cybersecurity measures ensures these systems operate safely and effectively, producing patient care and hospital operations. To mitigate the security risks we've discussed, encryption serves as a fundamental safeguard for protecting data within MCPS. Let's explore the types and layers of encryption that reinforce security in these systems. Encryption is a cornerstone of security for MCPS, protecting sensitive data throughout its life cycle, from collection to transmission and execution. MCPS utilize various encryption methods based on specific security needs: symmetric encryption, asymmetric encryption, and end-to-end encryption. The Cyber-Physical Internet of Things, or CMIoT, framework ensures encryption is applied comprehensively at every stage, with the sensing layer securing data collected from devices like heart rate monitors, encrypting readings before transmission. The network layer, which protects data transmissions over channels such as Wi-Fi or Bluetooth, utilizing protocols like TLS. There's also the data fusion layer, which aggregates and analyzes encrypted data from multiple devices, ensuring integrity and preventing tampering. The application layer, which encrypts data accessed by healthcare providers such as patient records and diagnostics to maintain confidentiality, and the execution layer, which secures commands sent to medical devices, preventing unauthorized control or interference. The diagram illustrates the CMIoT framework, showcasing how encryption is embedded at each layer. This layered approach ensures comprehensive security across all stages of MCPS operations. Encryption requires tailored implementation at every layer of MCPS to effectively address security challenges. By embedding security into every stage, healthcare organizations can ensure the safety and integrity of these critical systems. With a foundation in general encryption methods, let's now explore homomorphic encryption, which is a sophisticated approach that secures data in real time without ever needing to decrypt it. Homomorphic encryption, or HE, is a groundbreaking cryptographic technique that allows computations to be performed directly on encrypted data, ensuring sensitive information remains secure throughout the computational process. HE enables mathematical operations such as addition or multiplication on encrypted data, keeping the results encrypted until authorized decryption. For example, healthcare providers can analyze encrypted patient records for trends without exposing raw data, maintaining complete confidentiality. HE and MCPS security enhances it through protecting data in use, ensuring privacy, and securing collaboration. This image illustrates how HE fortifies MCPS security while highlighting areas that remain vulnerable without its implementation. Some of the vulnerable areas are unencrypted data transfers and legacy systems, which are incompatible with HE present exploitable weaknesses. And there's also potential attacker scenarios. Without HE, attackers can intercept data during computation, manipulate medical commands, or exploit cloud services to access sensitive information. The diagram showcases HE applications such as encrypted medical image analysis and secure vehicle-to-cloud communication. These examples highlight how HE can protect workflows in distributed real-time healthcare systems. Homomorphic encryption is the next frontier in securing MCPS, ensuring data privacy and integrity during computation. As healthcare increasingly relies on real-time data and collaboration, HE will play a pivotal role in protecting patient information. Building on homomorphic encryption, let's explore its application in MCPS through the HERM for MCPS model, which integrates encryption with advanced resource and privacy management. The HERM for MCPS model, the homomorphic encryption reference model for medical cyber physical systems, addresses challenges in encrypted healthcare environments, focusing on privacy, latency, and resource optimization. So what exactly is this model? Well, this is the framework. This framework leverages homomorphic encryption to enable secure encrypted data processing throughout its lifecycle, ensuring sensitive data healthcare and ensuring sensitive healthcare data remains protected from collection to decision making. Objectives of the model are privacy, latency management, and resource optimization. And this model includes a major mathematical component. This model uses a logarithmic equation to calculate latency, incorporating parameters like data volume and processing power. Weighted constraints prioritize critical tasks, ensuring timely responses in urgent situations. This diagram illustrates the HERM4 MCPS pipeline, where input parameters, constraints, and computations optimize latency and in-system performance while maintaining robust data security. The significance of the model demonstrates how encryption can enhance both security and efficiency, offering a practical solution for managing the complexities of MCPS in real-world healthcare. By integrating robust encryption with operational efficiency, the HERM4 MCPS model sets a new standard for secure, reliable, and sustainable healthcare innovation. Having explored encryption models and their role in medical cyber physical systems, let's now focus on the critical contributions of hardware solutions in ensuring the security and reliability of e-health systems. Hardware solutions are the backbone of secure e-health systems, providing a trusted foundation for encryption, data processing, and communication. They are essential for maintaining both integrity and performance in healthcare technologies. Some of the trusted hardware modules or models, such as the Trusted Platform module, is a specialized chip embedded in devices to perform secure cryptographic operations, generating and storing encryption keys. And then the hardware security model, which dedicated devices for managing and protecting cryptographic keys, often used in hospital servers or cloud infrastructures. There's also IoT device security. IoT devices such as health trackers and remote monitors use lightweight cryptographic chips to secure data transmission while preserving battery life. Hardware-based authentication ensures that only trusted devices connect to hospital networks, reducing unauthorized access risks. Physical safeguards are equally vital for e-health systems. Measures like biometric locks and secure closures protect medical devices from servers from theft or tampering, ensuring advanced cryptographic systems remain uncompromised. The diagram depicts a secure hardware architecture with components like cryptographic processors, persistent memory for key storage, and versatile memory for dynamic operations. These elements collectively enable secure data processing, transmission, and storage. When integrated with software and network system security measures, hardware solutions provide a comprehensive, layered approach to safeguarding e-health systems. Addressing security at the hardware level builds resilient and trustworthy technological foundations for healthcare organizations. After discussing hardware security measures, let's shift our focus to network solutions, which is an essential layer for securing data, communication, and ensuring the resilience of e-health systems. Network security is vital for protecting sensitive data as it moves between devices, servers, and cloud environments. Robust network solutions safeguard patient information and enhance system resilience against cyber threats. Data encryption. Encryption ensures the confidentiality of transmitted data. TLS encrypts communications such as between wearable devices and hospital servers, preventing unauthorized interception, and VPNs create secure communication tunnels for remote access, protecting sensitive data from external threats. Network segmentation. Segmenting healthcare networks into isolated sections, such as separating administrative systems from patient monitoring devices, limits the impact of breaches. If one segment is compromised, the rest of the network remains completely secure. And also firewalls and intrusion detection prevention systems, or IDS/IPS. Firewalls monitor and control traffic using predefined rules as the first line of defense, and IDS or IPS detect and block malicious activities in real time, such as unusual traffic patterns during a DDoS attack. There's also the zero trust model, which requires verification of every device and user attempting to access the network, regardless of their location. Factors like user identity and device health ensures protection against insider threats and unauthorized access. And finally, secure wireless networks. Healthcare wireless networks are frequent attack targets. Securing these networks with WPA3 encryption, strong passwords, and regular audits protects devices like heart monitors and insulin pumps from disruptions and unauthorized access. By implementing robust network security solutions, healthcare organizations can mitigate security risks, ensuring the seamless and secure operation of e-health systems while safeguarding both patient data and critical healthcare services. After examining hardware and network solutions, let's now shift over to software-based strategies, which are integral to reinforcing the overall security framework of e-health systems. Software solutions play a critical role in maintaining data security, enforcing access control, and ensuring e-health systems remain resilient against evolving cyber threats. Software encryption secures sensitive data through its lifecycle, with data encryption techniques such as the advanced encryption standard and homomorphic encryption being used. There's also authentication and access control. Strong authentication and access control prevent unauthorized access, specifically through the use of multi-factor authentication and role-based access control. Software patches and updates will also address vulnerabilities and protect systems from emerging threats. Outdated software is a common target for cyber attacks, making timely patching essential. AI-powered threat detection, with AI enhancing security by identifying unusual activity in real time. There's also backup and recovery solutions, which ensure critical data can be restored quickly after an attack or system failure, which completely minimizes paying ransoms in most cases. And finally, software solutions overall provide a dynamic and adaptable layer of security, complementing hardware and network measures. Together, these strategies create a comprehensive defense against modern cyber threats, ensuring the integrity and reliability of e-health systems. Having examined encryption, network, and software solutions, let's focus on blockchain technology itself. Blockchain technology provides a decentralized distributed ledger that securely, immutably, and transparently records transactions. This innovative approach addresses key challenges in healthcare, including data security and interoperability. So what exactly is it? Well, blockchain is a secure system for recording and verifying transactions. Each block contains a timestamp, transaction data, and cryptographic hash, ensuring records cannot be altered once added. This immutability is ideal for managing sensitive healthcare data where accuracy and security are critical. Its uses in e-health include securing EHRs, securing data sharing, and overall privacy protection. The diagram illustrates how blockchain applications across e-health layers. At its core, blockchain secures data and ensures privacy. In EHR systems, it facilitates secure storage and sharing of patient records. Advanced applications such as AI-driven healthcare processes also benefit from blockchain's protective features. Blockchain combines security, transparency, and efficiency, making it a powerful tool for modernizing e-health systems. Now that we've introduced blockchain in e-health, let's explore its key features that make it an indispensable tool for safeguarding sensitive healthcare information. Some of the key features of blockchain and e-health are one, data encryption. With blockchain, it secures patient data using advanced cryptographic algorithms like SHA-256. It also has a decentralized validation. Blockchain employs a network of nodes and consensus mechanisms such as proof of work or proof of stake to validate transactions. This distributed process ensures legitimacy while reducing the risk of tampering by malicious actors. It also has immutability. Records on the blockchain cannot be altered or deleted. Any attempt to modify such record triggers the detection of inconsistencies across the chain, preserving data integrity. And finally, transparency. While data remains encrypted and access controlled, blockchain allows authorized participants to view transactions. This ensures accountability and fosters trust among patients, providers, and regulators by maintaining a clear audit trail. These features make blockchain essential for creating secure, trustworthy, and reliable e-health systems. As healthcare digitization accelerates, blockchain will play a pivotal role in protecting patient data and enhancing system integrity. So let's briefly introduce three major blockchain frameworks shaping the future of e-health systems: MedRec, Ansil blockchain, and OmniPHR. These frameworks demonstrate blockchain's potential to address critical healthcare challenges, setting the stage for deeper exploration on the next slides. Let's first take a closer look at MedRec, a pioneering framework developed by MIT to address the challenges of managing electronic medical records. MedRec is built on the Ethereum blockchain, offering a secure, transparent, and immutable platform for healthcare data management. Ensures data access is restricted to authorized users while maintaining privacy and integrity. Its key components are the MedRec provider app, the MedRec patient app, and the database keeper. And some innovative features are smart contracts, where with private blockchain, smart contracts regulating data access, ensuring only authorized entities can interact with records, and incentive mechanism. Researchers mine the blockchain, contributing computational resources and enhancing security while gaining access to aggregated, anonymized data for studies. The key benefits of this framework are that it enhances data security, reduces redundancy, and it promotes patient empowerment. By decentralizing data management, MedRec reduces the risks associated with centralized systems, offering a secure, efficient, and patient-centralized e-health solution. Now let's take a look at the Ansil framework, a privacy-focused architecture designed to enable secure and policy-compliant data sharing in healthcare systems. The Ansil framework excels in scenarios requiring more sharing of sensitive data from diverse sources, such as IoT devices, medical sensors, and the patient records. Its governance ensures only authorized entities can access data under predefined policies. It's made of Ansil Web, which manages user credentials and defines use-based policies specifying who can access data and under what conditions. The Ansil Core, which enforces policies during data processing, ensuring compliance through workflows, and the Ansil Lib, which handles data requests and securely executes commands. So how does it work? Well, sensitive data from sources like wearable devices or hospital systems enters Ansil. Ansil Core then ensures interactions adhere to strict policies maintaining security in governments. Authorized users or applications access process data while original data sets remain private and protected. Its key security features are its policy-based governance, advanced cryptography, and transparency and accountability. The Ansil framework ensures healthcare data is managed securely, transparently, and in compliance with privacy regulations. And lastly, the OmniPHR system leverages blockchain technology to create a secure and seamless platform for managing health data across multiple healthcare providers, prioritizing interoperability and consistent patient record updates. It has a multi-layered architecture consisting of the superchain, which is a multi-blockchain middleware that synchronizes and connects provider blockchains for cohesive data management. The OmniPHR client module, which manages local patient data at the provider level and syncs it with the superchain for system-wide integration. And peers, or the blockchain nodes, handle data replication within providers, enhancing fault tolerance and maintaining consensus. So how it works. First, healthcare providers upload patient data to their local OmniPHR client module. Then the data is securely replicated across peers via blockchain channels. And finally, the superchain ensures interoperability, connecting local systems to maintain a unified, consistent patient medical history across providers. It supports security features such as TLS, decentralized architecture, and blockchain immutability. The Omni PHR system delivers a secure, interoperable, and patient-focused platform for health data management. Its multi-layered architecture addresses key challenges of interoperability, data integrity, and privacy, making it an essential innovation for modern healthcare environments. While blockchain offers numerous benefits for securing and managing healthcare data, it also faces significant challenges, particularly when scaled for widespread adoption in healthcare systems. With its first challenge being scalability. As transition volume increases, validation times can be slow, delaying access to critical patient records in time-sensitive scenarios like emergency care. And it's also very energy consuming. Blockchain networks use proof of work or POW, which requires substantial computational power, resulting in high energy consumption. This is essentially problematic in resource-limited settings, such as rural healthcare facilities. There's also equity issues. Blockchain adoption may widen disparities in healthcare delivery, particularly in rural or underserved areas, lacking the necessary infrastructure. And also data privacy and regulatory compliance. Regulations like HIPAA or GDPR pose challenges due to blockchain's immutability, which conflict with the right to be forgotten set of mindset. Innovative approaches such as off-chain storage or privacy-preserving protocols can help balance regulatory compliance with blockchain's benefits. By tackling these challenges, blockchain can become a more effective, sustainable, and equitable solution for transforming healthcare systems worldwide. As we look ahead, it's clear that advancements in cybersecurity and blockchain technologies will significantly influence the evolution of e-health. Here are three key directions shaping this transformation. Post-quantum cryptography, or PQC. Both quantum computers pose a potential threat to traditional cryptographic methods, leaving sensitive healthcare data vulnerable. PQC focuses on developing algorithms resistant to quantum attacks, ensuring long-term security for systems like EHRs and blockchain networks. This will be vital for maintaining trust and protecting patient data in a post-quantum era. 2. Low-energy consensus mechanisms. To address the environmental and financial concerns of blockchain, low-energy consensus mechanisms such as proof of stake, or POS, are gaining traction. Unlike energy-intensive POW, POS reduces energy consumption, making blockchain adoption more sustainable and accessible, especially in resource-limited settings. And enhanced frameworks. Future blockchain frameworks will focus on interoperability, scalability, and compliance with stringent data privacy regulations. These advancements overall highlight a future where e-health systems are more secure, sustainable, and integrated. By addressing emergent challenges and leveraging innovative technologies, the next generation of e-health will provide safer, more efficient, and globally accessible healthcare solutions. Building on the discussion of post-quantum cryptography as a future direction, let's delve a little deeper into quantum cryptography and how it compares to classical methods. While classical cryptography, like RSA, relies on complex mathematical computations, it is vulnerable to quantum computers capable of breaking encryption through advanced quantum algorithms. In contrast, quantum cryptography leverages principles of quantum mechanics, such as quantum key distribution, or QKD, to create encryption that is virtually unbreakable. So why is it so important for e-health? Well, sensitive patient data, whether stored in EHR systems or transmitted via IoT medical devices, must remain secure for decades. Without proactive measures, advancements in quantum computing could jeopardize this data, threatening patient privacy, trust, and the integrity of healthcare systems. It can be used in healthcare by securing communication channels, creating quantum-safe blockchain integration, and overall enhancing IoT security. But it also comes with a lot of challenges, specifically high costs, lack of standardization, and complex integration. As quantum computing evolves, the healthcare industry must address these challenges proactively. Balancing innovation with feasibility is crucial for implementing quantum-proof encryption, ensuring long-term scalability and reliability of e-health systems. Following our discussion on the importance of quantum cryptography, let's focus on quantum key distribution. QKD presents a cutting-edge approach to encryption that leverages quantum mechanics to securely exchange encryption keys between two parties. This method is especially critical in e-health, where the protection of sensitive patient data is paramount. Now, here's a little bit about how it works and why it's considered one of the most secure encryption techniques available. It starts with photon polarization. The process begins with Alice, the sender, generating photons and assigning each a polarization, vertical, horizontal, or diagonal, to represent binary values of zeros and ones. A fundamental principle of quantum mechanics ensures that these photon states cannot be measured without altering them, forming the basis of QKD security. Then, transmission and measurement. Alice then transmits the polarized photons to, let's say, Bob, the receiver. Bob uses two types of beam splitters to measure the photons, one for vertical and one for horizontal polarizations. And then he uses one more for diagonal. Since Bob doesn't know in advance which splitter aligns with each photon, some measurements will match Alice's polarizations, while others will not. Then it has key shifting. After transmission, Alice and Bob communicate over a public channel to compare the polarizers they use without revealing their actual photon measurements. They retain only the data where their polarizations align, discarding the rest. This results in a shared encryption key known only to Alice and Bob. And eavesdropper detection. If, say, an eavesdropper, Eve, attempts to intercept the photons, the act of measuring them disturbs their quantum states, introducing detectable errors. By analyzing error rates during key exchange, Alice and Bob can identify interference and, if necessary, abort the process to maintain security. In eHealth, QKD secures communication channels for transmitting sensitive patient data between hospitals, clinics, or research institutions. It effectively protects encryption keys used in EHRs and Internet of Medical Things devices, ensuring patient privacy and preventing data breaches. Building on the advancements in quantum cryptography and secure communication, it's clear that technology continues to redefine the landscape of e-health. Emerging innovations are providing exceptional opportunities to enhance care, improving efficiency, and achieve better outcomes. So let's explore 4 key technologies poised to transform healthcare. There is artificial intelligence. AI is revolutionizing healthcare through predictive analytics that identify patients at risk for conditions like diabetes or heart diseases before symptoms appear. AI-driven diagnostics, such as advanced radiology imaging tools, detect anomalies with accuracy surpassing traditional methods. Then there's also 3D bioprinting and regenerative medicine. 3D bioprinting is transforming regenerative medicine by enabling the creation of patient-specific tissues and organs. This technology addresses critical challenges such as transplant shortages. There's also augmented reality and virtual reality. AR and VR are enhancing medical training and patient care, with surgeons using AR overlays for real-time guidance during procedures, improving precision and reducing errors. And there's also VR therapy, which accelerates recovery and pain management and rehabilitation by immersing patients in interactive, engaging exercises, leading to better outcomes. And finally, wearable nanotechnology. Wearable devices are becoming smaller, smarter, and more capable thanks to nanotechnology. Advanced sensors embedded in smartwatches, heart patches, or other devices monitor vital signs such as glucose levels, heart rate, and oxygen saturation. These innovations empower patients with real-time health tracking and provide healthcare providers with critical data for proactive care management. Overall, these technologies are revolutionizing individual aspects of healthcare while reshaping how the entire system operates. After examining emerging technologies in e-health, let's shift to our focus to best practices for their successful implementation. First being a needs assessment. The first step is identifying specific gaps or inefficiencies within the system and determining which technologies address them effectively. Next is multidisciplinary task forces. Assembling a multidisciplinary team of healthcare professionals, IT experts, data analysts, legal advisors, and administrators ensures all aspects of e-health are comprehensively addressed. Training and change management. Staff preparation is essential to technology adoption. Training equips users with the necessary skills, while a strong change management plan addresses resistance and highlights the benefits of the new system, fostering a smoother transition. There's also privacy and security compliance. Strict adherence to regulations such as HIPAA and GDPR is non-negotiable. And scalability and interoperability. Technologies must be scalable to accommodate growth and interoperable to facilitate seamless data exchange across systems and providers. And just a plan for long-term sustainability, ongoing maintenance, staff training, and adaptation to regulatory and technological changes ensure technologies remain effective and relevant over time, supporting sustained impact. By following these best practices, healthcare organizations can effectively implement emerging technologies, enhancing patient care. As we approach the end, it's important to reflect on the key insights and advancements I've discussed here today. From the transformative potential of e-health systems to the innovative solutions addressing security, we've explored how technology is reshaping healthcare. Let's summarize briefly the most critical takeaways of what was discussed today. We began today by understanding the critical role of e-health systems and their numerous advantages, such as improved accessibility, operational efficiency, and better patient outcomes. At the same time, we addressed the challenges that accompany these benefits, including security risks and implementation complexities. We then explored innovative solutions like blockchain technology, quantum-proof encryption, and frameworks such as MedRec and OmniPHR. These cutting-edge tools are paving the way for secure, scalable, and interoperable healthcare systems. And lastly, we've delved into emerging technology and provided best practices for their implementation, ensuring that they deliver maximum impact while maintaining compliance, security, and sustainability. Technology in healthcare isn't just about innovation. It's about building trust, safeguarding privacy, and ultimately saving lives. The advancements we discussed today are crucial steps towards a more connected, efficient, and secure future in healthcare. Thank you for your attention, and I want to say a special thank you to Professor Cheekin for being so understandable and lenient during my illness. I really appreciate it. Thanks again.